Buddy, it's Matt here from Ok Aussie. Dyan is just down there having a big yawn, which is a good thing, but it's actually about sucking in the air at the moment. It's Sunday the 16th of February, 1:16 p.m. It's 35 degrees outside, so it is certainly warming up. Dyan's oxygen has been flapping a fair bit at the moment, so we're getting stats down into the mid and low 80s for some reason, dropping up and down. She's had some heart engagement, and we've employed the nitrolingual spray twice already. Now that's normally not a good sign when we're on to the second dose of that. Still complaining of chest pain right now at 117. So we're monitoring that. Heart rate is one thing, but also there is blood pressure. Blood pressure for her at the moment is 93/60. It's just dropped down a few points from the previous reading, which was at 97/63. So we're seeing a bit of a drop in blood pressure. We've got the pulse oximetry onto her with alarms indicating that she's dropping into the sats, but it's up and down. Hearing a bit of Krebs sound in the left side still of her lungs. You can't play with that Maxi Moo. Jeez, dude. Come here. Max is trying to help greatly. As we do this, he's very good at helping, not. Do you want some more spray? Dyan's been very fatigued looking, a little bit losing of consciousness during this as well. Lots of yawns as she's trying to suck in the air. So we're just currently monitoring her condition. If you're feeling chest pain, let's go for it. The nitrolingual or GTN spray, or just as a vascular dilator. 118 applied, third dose. I've just turned the aircon on as well. Her core temperature is 37.0 degrees. I'm just keeping an eye on temperature, responsiveness, just preparing in case we've got seizure activity going on. Just that your saturations are flapping everywhere at the moment. So we're getting a lot of up and down spike activity as we go through. Heart rate's also been a bit variable. Down as low as 52, all the way up into the 70s and 80s. It's just flapping. Normally when we see the heart rate do that, normally it's indications of maybe dystonia or seizures coming through. So we're just keeping an eye on those actions for the moment. Good boy, Max. Hey Google, set timer, 5 minutes.
All right, 5 minutes.
So with the 5-minute timer, we're actually now monitoring the GTN spray to see how well it responds and see if there's any change in her condition. Obviously, if this continues, then we need to think about whether we need to do ambulance and hospital. Max, you're not helping, dude. You're not helping. I keep telling you, you're not helping. Still getting chest pain. Okay. Oxygen stats currently at 92/91, heart rate's at 62/63. That's a really good question. So what's actually adding to this? Chili. Oxygen stats are at 90. Down you get, little man.
I know that. I have chili.
No, so what have you actually done recently? Now, Dyan is having poor sleep each and every night. So since coming out of hospital, from the neurology department where she's had seizures every single day, she's come home to be having neurological activities every single night. There hasn't been a night without that. It's also broken her sleep patterns. She hasn't been able to get to sleep until at least 2 o'clock every single morning. So we're having fractured, lower quality sleep. That's the alarms that go off when her device goes off, and that's why we have this set up so that we can monitor. I've also got on her right arm the night watch device, which is also another audible alarm in case heart rate stops or if there's any movement sensation. And of course over here we have the SAMI 3 camera, which is consistently monitoring her for the clinical team recording. But for the moment we're just trying to get some fluids, so we've given her some water. We've got her feet elevated just a little bit as well. Sorry? The water's cold? Or the air conditioning's cold? Yeah, I want you to be cold at the moment. I'm sorry. I'm just bringing your temperature down a little bit. It's a little bit high. So the sleep side of things hasn't been good, and that's since coming immediately out of hospital. So she's gone to hospital with a significant UTI. That wasn't attended or addressed. In fact, the seizures. She had a seizure in ED, go blue, and that didn't stop. She had 9 seizures that day, and she's had seizures every day subsequently at hospital. They couldn't do any more with her in regards to the seizures. They certainly didn't look at the UTI. They've sent that onto a referral onto obviously infectious disease and neurologist, but they've sent her home. So now every day she's now been dealing with neurological conditions and, of course, like I said, disruptive sleep. And the same symptoms are going on for the UTI. How's your pain been today, Di?
Good.
Good. That's a happy, cappy thing. Except for the chest pain, yeah. Now, each and every other day we've been having to give tramadol. Now, that's really bad indications for Dyan because we don't normally give tramadol. That's a last sort of step for Dyan with the pain, and that's because of the UTI. So she's off antibiotics, waiting to get a new clean capture. Of course, it takes anywhere up to 28 days to have all the antibiotics out of your system to be able to get a clean capture to then be able to represent and showcase, hey, we've still got the same highly complex, multi-drug resistant, biofilm protected UTI, and that's what happens with the Klebsiella. It actually embeds itself into the wall of the bladder in that biofilm. That means it's not free floating. If it's not free floating with particles, those particles don't discharge as it comes out in the urination, which means you don't get it in the clean capture. So therefore you're not getting a pathology result once it's stuck in a biofilm. Hey, so you need to actually be able to break down the biofilm and then get to that multi-drug resistant bacterium. Sorry, I'm keeping you cold for the moment. I don't want you going too warm. Just keeping an eye on what's happening with you. How are you feeling in your body at the moment?
Cold.
Oh, well, cold's a good thing.
This chest.
Still with chest pain?
Like this.
So apart from the angina, could we be getting some arrhythmias? You haven't. That's the 89% threshold of the oxygen saturation drop. 88%.
I get the pain that happens.
So every time you get the pain, it correlates to a drop in oxygenation. Okay. You're not having any feelings of dystonia or anything anywhere? Okay, let's do a quick little neurological test just to make sure. I asked that question because I don't want dystonia in pharyngeal or in diaphragm affecting your breathing. So only pain in the chest at the moment. Okay. No focalized dystonia in feet or hands, just feeling cold. Sorry, Maxie. Very warm to touch. We're about to have our alarm go off for the 5-minute warning from Google. Hey Google, stop. So that was 5 minutes. Is your chest now feeling better after the GTN spray? Oxygen stats are 87, 88. Now, having been to the hospital recently, we also had the opportunity to calibrate the equipment that we use, the pulse oximetry device, the wearable one that Dyan wears, and the reports, and they calibrated exactly with all multiple hospital type equipment. I was also using another pulse oximetry device, so we use multiple devices just to cross-check ourselves, making sure that one device is not giving us a false reading, and that was also supporting. So this device was showing very low oxygen saturation, hence why we've gone now to the wearable device. That gives us data which we can actually report upon, because we can store that data from the wearable device into the report systems. These ones, unfortunately, are just standalone and don't give us that sort of data. I would love to make it stop, Sweet Pea. Okay, I'm just going to try something. I just want to bring you up a little bit more. Your heart rate's been accelerating during those pain cycles, then your oxygen saturation has been depleted during those same cycles. Okay, we expect a heart rate spike to occur a bit more after taking GTN spray and for it to settle down. Stay awake with me, please. Have some more fluid. No. Just a sip, please. Sorry. Please. I know you're not feeling very well, but I need to. Sweetie. Okay, might be going into seizure behaviour soon too. This is not going to be a fun sort of day at all. With the start of the symptoms, I also took the compression stockings straight off. So Dyan has got lower peripheral compression stockings that she was wearing from the vascular team, which is meant to help the edema. So I've taken those off at the moment. I've also got the feet just elevated currently. Chest pain still showing. Now it's very hard to differentiate with Dyan being so tired and so run down. She's come out of hospital when really she should still be in hospital. She's been dealing with seizures and neurological events every single day and night. Normally up to 3 to 4 hours of the Tourette's mixed form dystonia going into it as well. So it's not surprised that she's feeling fatigued. The pain levels have still been high from the UTI, needing pain relief daily. That doesn't actually help her cardiovascular. Now, while we're at the hospital, those same alarms that you're hearing here, we're hearing obviously while she was on the EEG, the 4 days of monitoring. She was having heart rate drops down to 33 and spikes up to 170 BPM, and she was having oxygenation drops, saturated oxygen drops below 85% quite continuously as well in hospital. More referrals off to respiratory and off to cardiovascular. Referrals off to immunology, infectious disease, as well as neurology, and also referrals off to pain management. But that doesn't help Dyan here and now at home, when we're just trying to make sure that she is safe and that she's not in pain and not potentially at risk. So there's obviously high precedence risks of seizures today. Outside temperature is currently 34 degrees, so it's just starting to slowly come down. It was 35. The inside room temperature is nice. Heart rate's pulse is a little bit high for me, but normally that's an indication of pain. So currently it's at 80 BPM. Now, normally for Dyan resting should be around that 55 and 60, 84 and increasing. Oxygen stats are at 96%. You're feeling hot now. Just changing the temperature at the moment of the room and dropping that down to correspond. Heart's racing. Heart's at 85 and it is actually racing for you. Oxygen stats are remaining at 93%, 92% and dropping. Funnily enough, just actually engaged with Oxygen West, 91%, waiting to get an oxygen concentrator through to Dyan so that we can actually help her with supplemental oxygen while she's in these situations, currently at 90% and reducing further. Her heart rate's at 90%, so it's actually increased. We're getting some dystonia in the face, I believe. So we're probably triggering into some seizure activity at the moment. I'm just going to take her down. Oxygen stats are at 91%, heart rate's at 86%. Just take that pillow back one second, please. Sorry about the camera rate today, but we're just focusing on where we're at. Oxygen stats remain low, 90%, 89% threshold's just been hit. Heart rate remains high for her. Her heart rate should be at 55 beats per minute because she's lying supine. However, we've got an increase by about 25 to 30 beats per minute. Static, not doing any activity. Oxygen stats are at 87%, alarms going off. Just keeping an eye now for any other symptoms that may be occurring. It is Sunday the 16th of February, current time is 1:32 p.m. Oxygen stats are currently out of threshold, we're at 90% oxygen saturation, heart rate's at 78%, still remaining high. Still indicating chest pain. Have you had any TAMs, herbal laxatives at all today?
No.
No. There's no sense of indigestion or other sort of factors coming into play here? No. You've been eating all your normal foods, so nothing different in what's been eaten?
No.
No. %, oxygen saturation. Just reducing the alarm volume down so that we don't trigger. Willow, that ain't helping you going and hiding underneath the sheets, dude. I can tell you that for sure. Stay with me, bro. Just trying to stay awake. Oxygen stats are at 88%. Heart rate's dropped down to 75%. As I said, we've just been engaged with oxygen concentrator with Oxygen West, trying to get that through. So for two areas, one for any seizure activity where we can have a continuous dose of oxygen and improve our oxygen saturations during seizures or dystonia type events, but also one that can provide pulse oxygen when oxygen saturations are dropping from fatigue or just simply having 22q11.2 deletion syndrome. She's still at 88% consistent, heart rate's still higher at 84, 85. That's not going down, which is my concern at the moment. You can see both eyes are out. She's had a lot of yawning in between all of this, where she was obviously a bit of oxygen starvation, trying to grab some oxygen in. Temperature still remains consistent, 37.0. Now look, it's not a febrile temperature, 37.5 and above or 38. But for her, that's actually high, and we're actually in a controlled environment room. 34 degrees outside, it'll be about 22, 23 degrees inside at the moment. Well, I'm just looking now for signs of blepharism, so I'm starting to see some eyebrow activity, some mild fibrillation around the jaw occasionally. So what we might be getting is some of the segmented cranial dystonia. So with the eyes, that'll be the blepharism. With the jaw, if it comes through, would be the oromandibular dystonia type events affecting the TMJ, the transmandibular joint. The alarm's still going off because we've got oxygen sitting at 88, going up to 89% currently. Heart rate's at 77, which is a better heart rate. I'm looking for other indicators. She's not sweating out at the moment. We're not getting pain radiating around the chest into the back region. She's not wheezing, so she's not got dyspnea. We're struggling of breathing at the moment. It's low, but she's still fulfilling oxygen needs. We're not getting other associated aches or pains in the body. Current time is 1:36 p.m, Sunday 16th of February. Alarm trigger has terminated. We're at now 91% oxygen saturation. Heart rate is flapping around 77 to 80. You're feeling a bit chilly, that's okay. We still need to bring your temperature down, I'm so sorry. Even Willow's feeling how cold it is. He's tucked underneath the blankets, and he's meant to be a cat designed for the cold weather.
Oh.
Chest pain?
Yeah. Ow.
I can give you some more GTN. Do you want to try that? Will it help? Sorry? Yes?
Oh.
Yeah, that's... Hey, look, according to the cardiologist, we can just knock them back. He's not here, so you're happy to go and proceed. Indicating with mouth open. GTN administration. 1:37 p.m. Hey Google, set timer 5 minutes.
Alright, 5 minutes. Starting now.
Current levels, oxygen stats are now at 95. We've got a heart rate at 73. Let's just see if her heart rate with the vascular constrictor changes with that medication. We'll just keep an eye on that. So a lot of flapping going on at the moment. You can see the fatigue in her. You can see sometimes the non-responsiveness, a bit of syncope coming through that as well. And looks like we might be on the origins of a bit of dystonia, so just keeping an eye on what happens there. Time's been set for 5 minutes. I'm not going to apply any additional spray during that time. I just want to see how she responds to that. Just going to raise the head of the bed up a little bit.
Oh.
Just to there. 10 to 13 degrees.
Oh.
I know you're indicating your chest, sweetie. I've given you spray. Do you have any pain going around to your back at all, into your shoulder blades around the side? No. Breathing rate is slow and steady, just counting the respirations. Oxygen stats remain good at 95%. Heart rate's at 74%. As I was saying while we're waiting for Dyan, so I've been talking to Oxygen West. They're just trying to coordinate and get a machine that does both things that we need. We have two different areas. One where we need a continuous delivery of oxygen, that's during the seizure or dystonia event, particularly when she may not be able to draw in through a pulse dose. And then we need one that can also deliver pulse dose for the energy conserving when the heart oxygen stats are below. Now, normally 95% and below is when you start going, well, why is there some sort of issue? Obviously, if it's 90% and below, I start to get a little bit more on the concern side, and particularly when we get threshold alerts appearing below 88% oxygen saturation, that's when supplemental oxygen should be being applied. And that's why we will have then the pulse oximetry so we can monitor those stats, increase the oxygen levels to where she needs and reduce it and take that off if we need to do at that time. Okay, that's fine. I'm glad that you're able to engage and tell me that. I'm going to bring that back up to 24, turn the fan down by 1 and just turn it off for a second, just so that you can warm up. Okay, so we've got those things happening. We've got the countdown timer over here, still counting down since the GTN, so we've still got about 2 minutes left since the spray. I want to see her responsiveness to that. And she's now calling on the Doona and going into left recovery. Now, in the old days when we used to have the seizures, this would be a common thing where the fatigue of doing a seizure activity would turn her to do a left roll and get into a sleep pattern, and she might want to sleep for 2 or 3 hours. Now, were we having some small seizure activity because of the heart rate spikes that are not visible as obvious tonic or clonic behaviour? Can't tell. Don't know. Don't have the devices and the equipment to be able to look at that. What I do look at, though, is why is the heart rate spiking and doing those sort of behaviours. Now, she's very consistent. That's why we have resting heart rates. both in a supine or upright position. When she's going above 10 or 15 points above those levels, then it's sort of indications of pain. She's indicating chest pain, but we're seeing her oxygen saturations drop out. So I'm happy for her to rest for the moment. We're going to continue to monitor her stats during this time. Dyan, how's your chest pain feeling?
Still there.
Still there? You want to go down flat? That's okay. You can roll over. And I'm just going to keep an eye on you as you rest, okay?
Still there.
That's okay. We're going to monitor your stats. I'm going to take the alarm into silent mode so it doesn't disturb you, but I'm going to be visually monitoring that. Current oxygen saturation is at 90%. Heart rate is still 82 and high for her BPM. What are you doing with that? Get it comfortable on your hand. Now, it's obviously 1:41 in the afternoon. This is not a normal time for her to want to go to sleep. She never, ever, ever wants to rest or sleep during the course of the day like this. So for her to roll over, pull the doonas up and get comfortable really is an indication that she's not feeling terribly well and that the fatigue's coming in. And of course, the lower the dosage of the oxygen coming in, the less energy that you have, the less oxygen that you're providing to your vital organs, the brain included in that. Maybe that's why we're getting that syncope look and during those sort of exercises as well. Max, on the other hand, he's full of energy. He's still buzzing around, little Maximus. We need to keep an eye on him. Willow is still secluded over there underneath the blankets, resting up. Oxygen stats are at 93, peaking up to 94. Heart rate 76, 75. I'm happy with those levels. Hey Google, stop. That's my 5-minute timer. I'm going to keep monitoring this situation to see where it goes to, and hopefully things settle down. I'll give you an update soon. Currently getting a heart rate around 94, 95, oxygen stats are at 93. Seeing a lot of thrashing of the legs, commonly that would be seen with the generalised dystonia activity. There's that leg cycling, oxygen stats are dropping down to 91% as well, so just keeping an eye on that remotely while she's resting. Dyan's complaining of her head hurting at the moment, so pain from the head. She's been doing a lot of thrashing with the legs. Heart rate still remains high for her at 86 BPM. Oxygen saturations are at 93. It's been spiking all over the shop. But with the vascular dilation that's occurred with the GTL, I'm not surprised that she'll get a headache. So we're just going to give her some CBD. Your chest's still hurting. Okay. Well, none of that's good. Let's just give you some medication for this for the moment. Your heart rate's at 88, whilst oxygen is at 91. Okay, current time is 1:56 PM, just applying 0.5. Half a mil CBD THC. Doesn't taste all that good, does it? So as Dyan keeps saying, her chest is still hurting. Oxygen stats are at 91%. Pulse rate's still high at 89%. She's indicating that the feet are hurting. I'm just giving her some CBD to see whether that's going to help in that area. Quick little massage of the feet to see whether that does any benefit as well. Willow's on guard over there, keeping an eye, or just sleeping bed buddies. Not sure if you're helping Willow. I've put little Max to bed at the moment as well. Dyan is really all over the shop between oxygen and heart rate today, and pain. That's good. She hasn't done any distress with her breathing, which is a good thing, so no dyspnea. She's not hyperventilating or rapid breathing, so that's a good indication, even though the pain response has been high, so we're getting on top of the pain with CBD. Not quite sure where today's going to take us, to be honest. Stay tuned. So Dyan's been resting for the last 20 minutes or so. Stats have consolidated somewhat. We've had no more spikes of heart rate increase or oxygen saturation drops. which is a good thing. Chest pain is feeling like what?
Yeah, I think it's gone, I'm not sure.
Okay, quite a bit of dystonic leg cycling action while the resting phase. That was commensurate with heart rate spike increases during those periods as well, quite considerably. So I think you've got a bit of combination of dystonia going through, which is maybe the triggering event around this. Dyan wants to go to the toilet, so I'm just going to take her to the toilet. Let's help you up. Let's get you there, man. Return to bed. Okay. I've got a headache, I'm not surprised, after the use of the GTN spray. Now, I've been able to monitor Dyan in the other room whilst working on the notes, clinical notes and information for the medical team through use of the SAMI3 camera, plus also the Vicom alerts for her heart rate, which would obviously trigger and go off every time there's either a drop in heart rate or spike in heart rate or oxygen saturation through the thresholds. So having these devices makes my life a little bit more portable so that I can keep eyes on consistently, but also be alerted using multiple devices to the alarms, giving us indications if anything's going on. So toilet trip done. You're still a little bit sore, you're certainly a little bit on the tired side. Willow's been keeping an eye on you during your resting phase, which is good. Glad to see he's been able to help you. You can see his little eyes on the camera as he does that. He's finished his shift, he's off. Hello, Maxie.
Max.
You've come to help as well, have you, buddy? Good to see. Everybody's on board now. Come and see Mum. Guys, we're going to love you and leave you there. Thank you for sticking around and being available whilst Dyan's going through one of these type of exercise or episodes. I think there's a bit of dystonia going on amongst cardiac type events. It's currently 2:28 p.m. Sunday the 16th of February. Still 34 degrees outside. It's a nice temperature in here. Give Dyan a big thumbs up of encouragement and support. Comments, questions, ideas and suggestions, leave them below as always. If you're new to the channel, welcome. Dyan is a person who has got a chromosomal disorder, 22q 11.2 deletion syndrome. She was born with that. She had late diagnosis, but she had all the symptoms and signs all the way along. That means that she's missing about 30 to 50 genes. It affects about 3 million of the DNA building blocks, and it presents itself in about 185 different types of symptoms, and it's variable depending on each patient that you actually see. Now remember, we're not a medical channel and giving you guidance and information, so we're not clinicians. If you have questions or concerns, make sure you do see your own primary care physician or specialist about your own self and getting testing genetically or the condition symptoms. We're Dyan's just here to share her life with myself as her partner and carer, how we manage and what we deal with things. Is concerning. It is actually upsetting to me, having to obviously deal with out of hospital, not having the support with cardiology for cardiac related things, respiratory for oxygen related things, let alone infectious disease, immunology and urology for the UTI side of things, and then neurology throwing into that. So there's a lot of challenges. Dyan's seeing 22 different specialists at her main hospital, which is a tertiary hospital here in Perth, and we don't have a specialist for 22Q. So that's just our life. And of course, look, if any of these things pass certain thresholds that I'd set, I'd be on the phone to 000, which is our ambulance service, and getting Dyan off to ambulance. And once I have the medical oxygen concentrator here, it makes our life a little bit easier because we can provide obviously supporting complementary oxygen to help her sats. That's why she's yawning a lot as she goes through as well. So thank you for sticking around. We'll see you in another episode real soon, and hopefully Dyan will feel a little bit more better, a bit more chirpier and full of energy to do something. But at the moment she's just on bed rest and I'm on watch and wait. So thanks guys, see you soon. Bye for now.